Hello, everyone. Hope you are enjoying the conference so far, and thank you so much for joining our session today on Medicare enrollment. I'm Amol Joshi. I'm from Oracle Health Insurance Product Management team, and we'll be going over some of the digital strategies that you can adopt to give your Medicare Advantage and prescription drug plan members a true digital experience right from the beginning. That is the enrollment step. That's our first step that bennies take when they decide to go ahead with a Medicare Advantage and or a prescription drug plan. And over the course of past 10 years, Medicare Advantage plans have taken a lot of good steps in digitally connecting with their members once they are onboarded, mostly around how they can use the benefits offered by their plans, selecting providers or specialists, getting to know about the cost of various treatments, and most importantly, claim status as well as the case management for chronic conditions that this population suffers from. But their first interaction with these beneficiaries, that's the enrollment, is still mostly the same as it was in 2006 when these plans were first introduced. And given mostly the unchanged nature of this process, plans are missing out on building that bond of trust right at the first step, which makes it harder for them in the long run to build that relationship as bennies get used to the various benefits and programs that are offered by these plans. So today we'll go over what we can do during this enrollment process to get in touch with these beneficiaries digitally to extend that 360-degree member experience from the first step, and in turn reduce the cost around administrative work that goes into processing this Medicare Advantage and or PDP enrollment applications. But before we get into those strategies, I wanted to go over some numbers and look at why there is this need to provide that digital experience, right? So for first 10, 12 years of MA plans, the stereotype of a typical Medicare beneficiary was that they are more likely to use pen and paper and telephone over a computer and much less a smartphone. Now, that forced health plans to communicate with these members mostly via paper mail and if possible via telephone calls. And most of the CMS regulations also of the time mandated member notifications to be in paper form. But today, the reality is very different. That stereotype is no longer representative of a Medicare beneficiary. In the latest survey by Pew Research Center, 61% of US seniors indicated that they own a smartphone. A percentage of those who regularly use internet via smartphone or computer is even higher. And though this percentage falls down, as we start looking at higher age brackets of those nearing their 80s or beyond, we can expect it to only grow in those segments as well, given the efforts that organizations such as Older Adults Technology Services or OATS are putting in to make these beneficiaries acquainted and capable of using the digital services offered by today's technology. And Medicare Advantage plans cannot ignore this statistic as they focus on providing smooth enrollment experience for existing Medicare bennies, as well as those who are aging into Medicare. Now, what was the fastest growing group of online shoppers in 2020? That statistic was really surprising, at least to me, given the effects of pandemic-driven quarantine and majority of American workforce being cooped up at home. And it was the Americans 65 and older. This segment rang up an average of like $187 per month to become fastest growing group of online shoppers during pandemic. Granted, the spending was little less than the $300+ that were spent by 35 to 44-year-olds, but it still tells us that more 65+ seniors started shopping online during 2020 than any other segment. And some will call it pandemic effect, as it forced seniors to do online shopping. And in some cases, they may be right. But I'm looking at it a little differently. I look at this as pandemic acted as a catalyst to bring about this change in behavior that was already in the works. Increasing access to internet and smartphones was bound to make this segment the most logical to do many things online. And pandemic forced quarantine just brought about this change more rapidly. And more important item of note from this news, especially for Medicare Advantage plans, is this segment is now more and more exposed to the digital retail experience from likes of Amazon and Walmart, and from even their grocery stores or food delivery services like Instacart and DoorDash, where as soon as they buy something on their phones and computer, they are constantly kept updated about where their order is, what is the estimated delivery date, whether it is being shipped or is being picked up by the delivery driver, and where the delivery driver is, even to the degree of, hey, the driver is 3 stops away from making a delivery. So what we see from this is seniors are loving this. They like this real-time feedback and instant notification or instant gratification in some cases that is made possible by this new digital norm, and would be looking for the same experience when it comes to other facets of their life. And they are more or less getting it as well. Like if you look at other shopping experiences, for example, auto insurance, you can get everything done online. You don't have to talk to a broker or the auto insurance company. You can do everything online in 15 minutes in some cases, save money, and walk away with the ID card that can be printed right at home, and you are good to go. And that is not the experience they are still getting from Medicare Advantage plans. And now if you add to this mix another important statistic, so the number of MA plan offerings is growing significantly year over year, with more players that are coming into market, most notably provider health delivery system of sponsored health plans hitting the market more and more. In 2021, average Medicare beneficiary had the choice of choosing from 33 different Medicare Advantage plans. And these plan offerings were from 8 firms, 8 different health insurance sponsors, parent organizations. This is on top of the standalone PDP plans, as well as availability of MedSup policies that Benis can choose to get in conjunction with their original Medicare. It's a completely different option than Medicare Advantage plans. So suffice to say that there is a lot of competition in this market. And what we have seen in the past is that many older Benis who are in that 75 plus bracket, they don't tend to switch that much their plans as they have gotten comfortable with them over the past 10 years. But the 65 to 75 bracket and Medicare Benis who are just aging in or about to age in, that's where majority of the competition is. And that segment is now well versed in using technology and is getting used to the digital experience made possible by this digital revolution. So when we look at all these facts and data points, it's pretty obvious that MA plans must provide the kind of digital experience that seniors are currently getting used to if they want to excel in this market. And that will not only help them build that trust bond with beneficiaries from the get-go, but it will also reduce the administrative burden and associated cost of managing this enrollment process. So now we'll go over the Medicare Advantage enrollment process briefly and some of the strategies and digital solutions that you can use in your enrollment operations to provide that 360-degree digital enrollment experience. I'm not saying whole digital experience, but enrollment experience, because that is something that this population is craving for, and we are not able to provide it given our archaic legacy processes. So when you look at Medicare Advantage enrollment process, you can split that into 4 main stages. First one is the enrollment intake. You have a lot of channels through which these enrollments are coming in the door in today's world, mostly from beneficiaries, direct in the paper form or by your agents and brokers. Medicare.gov, the plan finder that CMS has, or also called as Online Enrollment Center. Your own plan websites. I see that many health plans are pushing their the sales process more and more to their website, so that the usage of paper is less, but it's not completely caught up yet. Your sales partner, so you may have partnered with grocery stores, pharmacies in your areas to sell your Medicare Advantage plans, your telesales call centers, and last but not least, if you're sponsoring employer group waiver plans, then those employer groups. So getting in enrollments from all these different channels in many different shapes and formats makes it very difficult to keep control of your enrollment inventory. But once you have it, you have to do a lot of eligibility verifications, as CMS has laid out in their Chapter 2 and Chapter 3 guidances. You need to check for whether the application is complete. You need to perform the Marks beneficiary eligibility query check to ensure that CMS has an appropriate record of those beneficiaries. You have to confirm the beneficiaries Part A and Part B entitlement. If it is a MAPD or PDP plan, then also the Part D eligibility. You have to ensure that the plan Ben is choosing on their enrollment application is available at their residence. You have to also ensure the election period that Ben is using to make this enrollment request is valid and available for that beneficiary. Based on the election period, then you have to assign the appropriate effective date for that enrollment. And if you are the enrollment is for a special needs plan, then also perform the SNP verification. For example, if it's a dual SNP plan, then checking with the state Medicaid agents whether the benefit has Medicaid benefits or not. If it's a C-SNP plan, then checking with their provider to ensure they do have that chronic condition for which the C-SNP is providing benefits for, and so on. So suffice to say, there are a lot of checks and verifications happening in the background to confirm the person is eligible for enrolling in that plan. Once that verification is complete, next comes checking with CMS, submitting that enrollment to CMS, their mark system, to get them confirm that enrollment in your health plan. Then processing the daily transaction reply report, TRR reply files that CMS sends on a daily basis. If there are any rejections, you have to look at whether some of those rejections can be addressed by making any necessary corrections to the enrollment request, or getting in touch with the beneficiary to capture those updates. And if their enrollment is accepted, then whatever other accompanying transaction reply codes that you would have received on TRR, you need to take that in and apply those updates, most notably the low income subsidy or late enrollment penalty related information. And then enable access to benefits for accepted members. And last but not the least, and the most important factor, member outreach and notifications. Now, member outreach may be needed in any one of the previous 3 stages. For example, if the application is not complete, you need to get in touch with the beneficiary to get that missing information. You need to provide them acknowledgement that their enrollment request was received. The RFI process for incomplete application is the one place where plans spend a lot of effort to get that information, either from bennies or their brokers. Also for broker assisted enrollments, you have to do the enrollment verification, outbound enrollment verifications, or OEV for short. Once the enrollment is confirmed, you have to let member know that their enrollment was accepted by CMS and what date the benefits will be available for them to start accessing, send their ID cards, evidence of coverage, and welcome packets. If the Benny has low income subsidy, as was made available to you from TRR, provide those low income subsidy riders to let them know what is the cost share they will have to pay at the pharmacy for their prescriptions. And if they have any gaps in their creditable coverage or any existing late enrollment penalty, then associated documentation or attestation, you need to provide those notices to members and then get the response back to complete that creditable coverage attestation process. So if you look at all of these different steps and the amount of checks health plans need to perform, and the possibility that some of those checks may not be completely done or possible based on the information available, it's obvious that there is a lot of outreach needed back to get back to these beneficiaries and get those missing pieces of information or attestations. So why is there a need for this better digital enrollment experience, right? So if you looked at that, the number of steps you have to go through, on average, it takes 10 to 15 days for beneficiaries to learn about final status of their application, whether it was accepted or rejected, and then a few more days to get their ID cards in hand. Given the nature of this process and the type of legacy systems health plans have in place to manage this pre-enrollment process, customer service often lacks up-to-date enrollment status, leading to member frustration. So even if the Bennies call your call center, customer service may not have enough details to tell them where their application is or what is the ETA on getting their ID card. Delays in your call centers, especially during this pandemic season, or mail delivery delays will further degrade your enrollment experience. And multiple member outreach scenarios make this process even slower. And that slow nature of that process is hampering that building of trust. If the person calls your call center and you're not able to provide them good status or when their enrollment will be accepted, what are they going to say about your control of the process, right? I mean, it's not a great first step to building that trust. So we'll go over some of these challenges that health plans face in each of these major steps, and what digital strategies or solutions you can put in place to address them. So in the first stage of enrollment intake, major challenges are many health plans are still getting paper-based enrollment forms. I know the big players in the market are switching more and more to electronic and getting enrollees directly landed on their enrollment website to capture the enrollment in electronic format. But majority of the mid-size and smaller size plans are still doing business in paper. And lack of standardized electronic enrollment format also hampers how you work with your brokers, partners, your electronic marketing organizations. The OEC enrollments from Medicare.gov Plan Finder. Till last year, the only option to get them was manual download. You have to log into HPMS on a daily basis or during AEP multiple times a day and manually download enrollment files from HPMS and then import them into your enrollment solution or enrollment system of record. missing information on these paper enrollment forms or not properly edited electronic enrollment forms would make it even harder for you to process enrollments quickly and get them over to CMS. So when we look at all these challenges from Intech perspective, what you can see or how you can use digital strategies or digital solutions that are readily available in the market, or even you can build them yourself. It's pretty obvious, right? You have to move towards real-time enrollment capture. And when you are capturing that enrollment right there and then, have proper edits in place to ensure that you are capturing all the needed information. You can build APIs for enrollment intake to connect your plan website or even third parties to your enrollment system of record, so that there is no lag because you have to get the enrollments from your partners in electronic files, translate them in your native enrollment format, and then process them, or even have chances of missing some of the files. As I was saying, till last year, OEC enrollment were all manual, but last year CMS came out with the OEC enrollment API, which you can use and you should use to download these enrollments in near real time, so that you can get these beneficiaries started on their enrollment journey and get them uploaded into your system multiple times during the day using automated API calls, and reduce that turnaround time from enrollment intake to getting the confirmation out to beneficiaries. For working with your partners, such as brokers or marketing organizations, having a flexible mapping and transformation service to quickly onboard these new partners will enable you to start onboarding these partners quickly, regardless of what type of format they are comfortable in using. You don't have to force them to start translating files into your own required format, right? If the mapping is done and the data elements required on a Medicare Advantage or PDP enrollment form are pretty standard, you can onboard these new partners pretty quickly and get started. The second stage, the eligibility verification, that's where, and the last stage, the member outreach notification, is where you can definitely do tremendous improvements by implementing digital solutions. So as we spoke about in terms of eligibility verification, major challenges are, what if the Benny has provided inaccurate information? That drives no match condition when you perform that marks beneficiary eligibility query check. The manual processes that are currently in place in your enrollment department to validate election periods, and the need for beneficiary outreach in case there are multiple effective dates are available, if the Benny has multiple election periods available to them. Residence address verification, if needed, to determine which county the Benny resides in. And if you are sponsoring a Disney plan, then checking the Medicaid status or verifying that the Benny has Medicaid, the appropriate type of Medicaid to enroll into your Disney plan. So what can you do to address these challenges, right? CMS, again, last year, I'm saying, repeating this, CMS last year. So 2020 was a big year for CMS in terms of going ahead with these digital changes, right? They came out with a lot of improvements to Medicare Plan Finder in 2019 as part of their e-Medicare initiative. And that has continued in 2020 in helping MA and PDP plans do their business much better with these APIs that they are making available. So rather than having batch interface where you send files and then they respond with another file, now they have made available the beneficiary in cloud, the big BEQ API, that you can adopt to do real-time beneficiary match and entitlement check. And every plan should do that. There is no need to not do that, because going ahead or keeping your existing batch means you are wasting time in that batch communication or back and forth. You can develop algorithms to use the data you receive back on that BEQ API response and the information available on the enrollment application to auto-verify or auto-identify the election periods that are available to the beneficiary. Do the entitlement checks there, apply hierarchy of the election periods, and assign appropriate effective dates. So not all election periods could be auto-verified. That's true, especially in case of some special enrollment periods. But majority of the non-SCPs can be validated using BEQ response data and the application date and data received on the enrollment from beneficiaries. For addresses, use address standardization verification APIs that are available in the market. USPS has their own APIs, plus there are various other vendors out in the market who have the APIs that can do this job for you to ensure that you are not only verifying the address exists, is valid, but also what is the county associated with that full address. So rather than looking at just the zip code of the address, you can look at the entire street address and city zip code to figure out which county the person resides in. And that in turn will allow you to ensure whether the plan PVP they are choosing to enroll into is doing business in that county, and proceed with the enrollment or put that as out of area or reject that as out of area. For Medicaid status verification, many states' Medicaid systems have EDI functionality wherein you can submit eligibility request 270, 271 to get the Medicaid status of that beneficiary. And though there will be some configuration required based on which state you are working with, you can have your digital enrollment system configured in such a way that this verification can be done automatically rather than manually. Getting confirmation from CMS. So this is one area that we know CMS is working on few things. They are in the process of building some APIs, but they are not available in the market yet for plans to start using. But going back to the major challenges in this area, it's enrollments that get rejected because of avoidable rejection. If your election period logic check was not appropriate, you will get your enrollment rejected, as many may have already used it. Accurate processing of TRR files and the hundreds, not 200s, like 300 plus reply codes that you can get back on the TRR file is a major challenge for many health plans. Even those who have automated systems don't have all of these reply codes automated. And keeping up with the CMS regulatory changes and frequent updates to CMS's MARC system is another major challenge that happens throughout the year. Previously, they used to have 3 to 4 releases a year, but in 2020, CMS went agile. So what that means from our perspective is they can push in a change to production any day, and we may not have enough notice to make changes on our end to meet those regulatory deadlines. So from digital solution perspective, what can we do, right? For avoidable rejections, having those upfront edits in your enrollment process using the BEQ information, as well as any additional TRR information that you may have received till date from CMS, use that to catch those avoidable rejections upfront and not let them go out the door. Many of the rejections might be timing and you may not be able to do much with them, but most others you can catch upfront. Have a business user configurable rules-driven TRR engine to auto-process your replies, all the TRCs that CMS sends your way. There is no way to get around that, right? You cannot have manual processing of TRR. Sooner or later, it's just going to be too much to do manually. And to address the regulatory changes and need for quick turnaround times in making those changes, you have to design, or in some cases redesign, modularized applications that are flexible and can be quickly enhanced to address CMS regulatory changes. You can take on the huge projects of updating or redesigning your legacy systems, or there are solutions available in the market that can do this for you. The last stage is member outreach and notifications, right? So as we discussed earlier, major challenges are multiple situations where there is a need to reach out to the beneficiary and get response from them. And that loop, outreach loop and response loop, adds additional delays in your enrollment process, the way it is handled and managed in today's world. Members not getting ID cards or letters quickly, that's another big challenge. Cost of mailings, not for small or medium size plans, but big health plans, cost of mailing is huge, given the number of pieces of mail you have to generate for each beneficiary, as it is regulated in many cases, as it is for Medicare with CMS. And then this one is one of my, from past experience, one of the major challenges, post-enrollment complaints that you might get if the Benny has LEP assessed on them, right? If nothing was done during the enrollment process to make them aware that they might get charged an LEP, you are going to have angry phone calls, or in many cases, a CTM complaint against you for having that LEP assessed on your members, these members. So from digital solution perspective, what we see happen is during the time when the Bennies send their enrollment application till it gets approved and they get an ID card, there is no single place these folks can go to see where their enrollment is at, right? Or if the plan needs additional information from them. Your enrollment reps are different than your customer service reps. So even if they make a call into customer service, as I said, there may not be enough information available in your customer service portal to capture that missing information. So there is a handover required to push the call from your customer service rep to your enrollment rep. So what we think would be useful to address this whole time period, or pre-enrollment time period, as I like to call it, is provide a provisional access to your member portals to these beneficiaries. As soon as they have submitted an enrollment request, it doesn't hurt to give them access to member portal. Of course, you have to clarify there that that doesn't mean they have all the benefits yet, but that portal can be a vehicle for you to notify beneficiaries about any information that is required from them, and for Bennies to be able to keep track of where the enrollment is, and if required, provide those additional responses. So you can cut down on a lot of that RFI time period by doing this access ahead of their enrollment confirmation. At the time of enrollment, you can also get consent from beneficiaries to receive email or text communication. And once you have that consent, there are many notifications that CMS came out in 2019 that can now be sent via email rather than paper. So what you will achieve with that is you will be able to notify beneficiaries quickly and cheaply, basically, because there is no paper mailing involved. Making digital ID cards available on enrollment acceptance will go a long way for members to start accessing their benefits immediately. And for the point about LEP complaints, at the point of enrollment, once you have done BEQ, whether there is a possibility of benefits getting assessed LEP. So why not make them aware of that possibility right there and then? You can put some additional algorithms in place to also give them a sense of how much LEP they are looking at. And if required, they can also provide the creditable coverage attestation right at that same time, which will allow you to manage that whole creditable coverage attestation process more efficiently. And with that member portal, if you can keep electronic copies of all communication there, whether it is allowed by CMS or not, that will go one step further in making your members access all the required details right in your member portal. They won't have to search for paper mail that they received 2 months before. So these are some of the strategies and solutions you can apply or develop to address some of these challenges you face during the Medicare Advantage and or PDP enrollment processing. Right. So once you start doing that, what it will do is give your beneficiaries or your members a window into how their future interaction with you is going to be, and help you build that bond of trust. So when we look at all these things that are happening in the market, the digital changes that CMS is doing, and where this the senior market segment is going in terms of their digital usage, what do we think about what the future of enrollment would be, right? So I just wanted to talk about that from my perspective. The future is very much giving them a real-time enrollment experience, right? End-to-end Medicare enrollment done all in real time. So with the services, meaning the APIs that CMS has made available, such as the BEQ API, and the services that we know they're working on, such as the Marks enrollment service, you should be able to get benefits to submit their enrollment request on your website and do all the verifications right there and then using the BEQ API. If there is additional information required from beneficiary, they are still waiting on your website. So you can directly send a message to capture that additional information. And even if that is not, the benefit is no longer there on the plan website, if you implement that provisional access to member portal, you can push those messages and get the response from them immediately. So, and with the Marks enrollment service that CMS is working on, you can submit that transaction once it is clean and all the information is available, and get acceptance and or rejection in real time from CMS. And if it is accepted, you can provide a digital ID card to beneficiary right there and then when they are still waiting on your enrollment website. So very much like the experience that they get in today's world in shopping other insurance like auto insurance. So that is where I think the future of Medicare Advantage enrollment would be. Now, of course, it depends on when CMS makes that those APIs available, but surely they are coming because CMS is understanding that this population is becoming more digital savvy and wants things done quicker rather than at paper mail pace. So when we look at all of this, I just want to go back to the original point. If you want to excel in this competitive market, Medicare Advantage plan need to provide that digital real-time experience because the seniors are getting tech savvy and using more and more digital services every day. And they want to have that same experience when they are shopping and for Medicare Advantage and submitting their enrollment request. With that, I'll conclude today's session. If there are any questions, I'll be happy to take them in the Q&A chat box now.